Hi, Lucas.
Hi,
Good to see
Ida.
you.
Good to see you. Thanks for having me.
No, I'm glad you could join.
Awesome. Looking forward to it.
Hi, everybody. Thank you for joining. We're just going to give a couple minutes in case there's a couple more stragglers, and then we can start. Let's just give it a couple minutes. Hi, Mary. Good to see you too.
Hi.
Hi, Mary. Mary,
Hi.
I didn't know I worked with your husband.
Oh.
Yeah, he's at the site consult liaison. Is he still at Tripler?
Yeah, he's outpatient department now.
Right.
Yeah.
Oh, good.
Mm-hmm. Oh, so you worked with him, huh?
Yeah. He was doing the inpatient before I left.
Right.
And it was
right.
he was
That's his
awesome.
That's his first love, but they moved him to
Oh, what a shame.
outpatient. Yeah, he loved that.
He was very good with the patients.
Yeah. Yeah, he really enjoyed it. He loves the patients. Thank you.
He brought out the best. He brought out the best for those that were depressed and anxious. I mean,
that's nice to hear. Thank you.
Hi, everybody. I see lots of familiar names here. That's great. Hi, Kevin. Hey, Misty, Naomi, Noreen. You're back.
Hey.
Shane, Trish. Wow. Hi, Amanda. Hi, Dr. Khan. All right. We like our faithful attendees here. This is great. All right. We're just going to start going through the slides and get started. Okay. Okay. Next slide. So anyway, as you know, free CME, distance technology, online learning, very convenient. Lots of interdisciplinary team members here, and we are a community of learning. Next slide. So feel free to just share any challenging topics, cases, patients, and just keep them de-identified. That would be great. Could be any topic, actually. Next slide. And of course, everything must be HIPAA compliant, and this, we want this to be a safe learning environment where we encourage each other and inspire each other. We do not create or establish otherwise provider-patient relationships. And so this is just being presented for educational purposes. Next slide. Okay, and so just make sure, I think you all know, right? You move to the bottom and you click mute on that chat box in the corner over there, the mute box. Next slide. Yeah, and then of course there's the chat tool where actually we love it if you put your name in the chat, your discipline and your organization, and it'll be good to keep a record of everybody who attended, and of course get your CMEs later. And of course, yeah, make sure you mute and unmute when you can share. Next, and in order to receive CMEs, there will be a link in the chat box towards the end where you just click on it to complete evaluation, and that will automatically get you CMEs. Next. All right, so our hub team, we've tweaked a little bit, but here we are. We have me, I'm the course director for this series. So any topics that you want here, please let me know in the evaluations form, and we'll discuss it with our team. We have Mary Gotham. Say hello, Mary.
Hi.
Yeah, she is a retired Hawaii Department of Health nurse in public health nursing for decades. So lots of experience to bear here. And we have Lucas Morgan. Say hi. He's clinical psychologist also. And next slide. And I saved Sara over here because she's actually going to be our speaker today. She's part of our hub, but she's going to be our speaker today. and she has more than 41 years of experience in geriatrics, probably in every area in healthcare that we can imagine, in geriatrics, health, mental health, long-term care, VA. She did Holly Kawiki for a while. She was a social worker at the Adult Day Center at Central Union. She's currently at HPH. So I think she's done everything.
Thank you for that lovely introduction.
She's gonna talk about dementia caregiver support, and she has
Mhm.
no conflicts of interest. Thank you so much, Sara.
Okay, thank you. It's so nice to see everybody join us. I'm very passionate about this topic with regards to dementia caregivers, in part because I have had family members that I cared for that had vascular dementia, and then currently we're secondary caregivers for my father that has mild cognitive impairment, and my mother, who probably is showing some early signs of dementia related to Parkinson's disease. I asked Ida if I could do this presentation because it's going to be pretty much interactive. I think that really helps everyone learn, and I want it to be really practical to people attending. Having said that, you might see some pictures of my family in here as well. But during this last year and a half, I think it's important as I reflect back at looking specifically with family caregivers that are taking care of people living with dementia. And this is National Family Caregiver Month, if you're not aware of that. And I know that they're going to share some resources, Michaela is, but the National Family Caregiver Month is a time for us to really recognize and show our appreciation for what caregivers do. And when you hear me mention the word informal caregiver or family, that's who I'm speaking about, is unpaid caregivers. So we're going to look at building resilience for dementia caregivers during this last year and a half of the pandemic. Next slide. I've kind of highlighted what the course objectives are, and it's pretty self-explanatory. So if you can take a quick look at that, we'll move on. So, you know, I was trying to look for a picture of a local family, and I couldn't really find one. But as we move to the next slide, most of you might be aware that the former First Lady, Rosin Carter, she was a caregiver for several family members. And when her husband left office, Jimmy Carter, she established this Rosin Carter Institute of Caregiving. And that is a great resource. And she's continued to expand what the Institute does. But her famous quote that I like to remind people of is that there are only 4 types of people in the world. There are those who have been caregivers, those who are caregivers, those who will be caregivers, and of course, those who will need caregivers. And just keep that in the back of your mind as we look at resilience. Next slide. So this is just a little, it was a little, I guess, quiz. And I'm not going to give you the answers right off the bat. You'll kind of, as I do the presentation, you'll kind of have the answers to these questions. But here we go. So I want you to think, this was data that was taken from the Alzheimer's Association. They have facts about family caregivers. And at the end of the presentation, we can also make available to that additional information. So what do you think is the percentage of caregivers that report depression? So make a note of that, choose A, B, or C. Question number 2, how many total hours of unpaid care do you think is provided by family caregivers here in the state of Hawaii? Number 3, what was the total number of caregivers in our state this last year in 2020? And with regards to question 4, which percentage of caregivers do you think had chronic health conditions? And number 5, in 2020, is this a true or false statement? In 2020, was the number of persons living with dementia age 65 and over, was it 29,000? And is it in 2025, the number of people living with dementia will be 35,000. So do you think this statement is true or false? Next slide. So for most of us who have been working with family caregivers, or if you are a caregiver, you can't begin to imagine how difficult it is trying to juggle multiple things in your life. I used to think that, multitasking was such a great challenge and I enjoyed doing it probably when I was in my 20s and 30s, but I don't really enjoy multitasking for a number of reasons. It's hard to really do a good job if you're trying to do 3 or 4 other things. But if you think for a minute, our caregivers right now in the community, they're stuck. I mean, this picture pretty much exemplifies they're juggling, trying to take care of their households, their responsibilities to their own families. They might be working, and not only they're caregiving for a person living with dementia, but some of them might be even caring for their grandchildren. Next slide. So as I asked in that earlier slide, it was very startling for me to learn some of these facts about family caregivers in Hawaii, that it's true that we will see a 20.7% increase or change in the number of family caregivers caring for someone that's over the age of 65 with Alzheimer's disease. And that I was surprised that there was a small number of only 51,000 dementia caregivers in Hawaii. So I'm curious to hear from other people why you think that is. I don't know if there's underreporting of that. I'm not sure how they got the data. And again, the number of total hours of unpaid care was 81 million. I'm just plugging my phone in because I'm using my hotspot. And can you begin to imagine it was over $1,021 of the value that they provide with unpaid caregiving. There's 65.3% of caregivers with chronic health conditions. And as you might imagine, that's everything from diabetes, heart and lung disease, etc. And surprisingly, there's 4.9% of caregivers that have reported depression. And 10.5% of caregivers do report that their health is poor. And the reason for that is most caregivers put their own health on the back burner. They're not going to go and think about keeping a medical appointment or follow up for their dental care. They don't have time to eat. They don't have time to exercise, and they barely have time to sleep. So that could get pretty depressing if you were a caregiver. Next slide. So I just, was thinking about my work in the adult daycare, and most recently, even when I was working in a memory care home. And I was thinking about how this has impacted our family caregivers. I was privileged to be able to do a caregiver support group for those when they had the lockdown. I don't know if people remember, that was in March of 2020, and we had this 1-month shutdown. And it was so devastating because, for a lot of the caregivers, when I talk about how their focus was protecting their high-risk parent, in the adult daycare, the health program, they provided respite for these patients, for these clients. And I noticed dramatically from February, around the 1st of February, till the beginning of March, our census was dropping dramatically. We had an average of 80 clients a day, and that would drop down to about 60. And then in March, at the beginning, before we shut down on March 19th, it was every week, it was like 4 or 5 people less. And I started polling, I started talking to the family members, and they just said, with this COVID-19 virus, we are not going to take a chance. My mother's not going to die on my watch. I'm not going to have my brothers and sisters get on me. So I had another family member, when I said the hoovering caregiver, she was saying, I sleep with my mother. I walk out to the mailbox with my mother. I wipe down the mail. I make sure that I've sanitized the newspaper. And it was just so heartbreaking to see that. happened to caregivers. There were also these unprecedented disruptions because you know how the information was quickly coming in. And unfortunately, a lot of our family caregivers are just getting the information from the news. And then when they surf the internet, you're not looking at the CDC. So it was always redirecting family members. I know you're trying to navigate balancing your life because they were also at work having been told that they were going to work from home. They need to quickly get themselves organized and prepare to do virtual work from home. Some of them were being riffed. They were cutting back on their jobs, and so they were worried about their finances. But it was a big burden for a lot of family caregivers because all of this was piling up on them. And since its onset, they have reported, even now, even though with people getting vaccinated, they still report quite a bit of difficulty coping and not having that kind of social support. And I still hear some caregivers asking me, should we vaccinate? Should we not vaccinate? You know, Sara, it was hard enough that we worried about something bad happening to mom. And then the mask wearing, that was another issue. A lot of people with dementia, they didn't know how to wear, they couldn't keep the mask on. In the daycare program, it was crazy because they would wear their mask wrong. The patients would say, I can't breathe, I have to take this off. And we just did the best we could. And then it was not just the face masks. Then we had to also wear the facial masks. And so communicating with our clients and your patients probably was also a challenge because they have hearing loss, they have vision loss. And so they're trying to understand what you're saying. And here it is, their caregivers were also masking as well. The biggest blow, I think, came when they had to start physically distancing, which they called social distancing, but it was really having to be 6 feet apart, which is physical distancing. But unfortunately, for a lot of people, it was difficult to make that distinction about, you know, what do they mean by social distancing, Sara? I hear that we just have to be 6 feet apart, but, you know, my family member that's in assisted living is being told that some of them are having to actually just keep themselves to their apartments. They can't come out of the apartments. We're going to have to think of ways that we can virtually connect with people. A lot of clients don't know how to use, and caregivers don't know how to use that technology. And if they don't have an access to iPads or computers to do that, that was really difficult for them those first few months. Lastly, I wanted to point out that increased dementia caregiver stress and burden can result in premature institutional care. And we were seeing that. We were seeing that in the adult daycare center, is that it got to the point where some of the caregivers weren't able to cope any longer with having to care for their loved one at home, as well as trying to take care of their grandchildren, make sure they were doing their schoolwork online, and then they had their parents. And then when I talk about caregiver abusive behaviors, some caregivers found themselves getting more, they weren't getting enough sleep and rest. And so they were getting more irritated. They found themselves being, I guess, yelling at their parent, sometimes swearing, and it just got really hard. And I'm trying to think, we didn't really we reopened the daycare program on June 1st, so it wasn't too bad. And unfortunately, we were one of the few places that had adult day health, so we could take higher level of care patients. But even then, it was a struggle for a lot of families. Next slide. So, when I talk about anxiety, the anxiety for the caregivers was kind of skyrocketed. They were worried about so many things, as I mentioned previously. But I think along with anxiety, they too were starting to feel despondent and feeling like, when is the end in sight, Sara? This thing about my parent, not being able to return to adult daycare, or if they're in the memory care home, we can't even do drive-bys right now because they're all being placed in their in the facility, or in their rooms. And amongst as all of this was going on, it was very interesting because for the people living with dementia, do you think they were upset about any of this going on outside? No. And so we tried to really make sure that there were set routines in the daycare program, and even in a lot of the memory care facilities. They did an awesome job in assisted living for those people, that if they had a consistent routine, and it was fine. They weren't upset. It was just that it was driving the caregivers, up the wall, because they were feeling guilty. I mean, like, I go routinely and I see my mom every Saturday. And I said, I know, but you do know they don't know what day of the week it is. So there's other things that you can try to do. You can, and then eventually they did phone calls. I mean, people were still doing phone calls, and they got iPads, a lot of the facilities, and they're iPadding. But a lot of the people that live with dementia don't know, why am I talking to this? Who am I talking to, in this little box? And one person had said after their meeting that they wanted to make sure that they were going to get some mochi to the daughter and the kids, and but it was really interesting. The physical separation for such a long period of time was hard. And I think what I found very helpful for caregivers, I said, sometimes you just have to give yourself a timeout. You have to stop looking at the news, stop reading everything that you can on the internet, because it's just overload of information. And you need to get accurate COVID facts. So go to the CDC. If you're not sure, talk to your patients, to your family member's doctor as well. We also saw that some family caregivers were having more use of substances, mostly alcohol. Next slide. So this is a picture of my parents. They're in assisted living, and my mom has lost a lot of weight. She's probably, in this picture, she'd lost already. They started going back and forth about letting them come out of the apartments, because whenever staff if the staff were positive for COVID, then they did a lockdown, and all of the residents had to stay in their room. And there was a time they were in their room for 6 weeks. So my parents were kind of going crazy with each other. But they managed, in September, they were coming out, and we noticed mom had lost a lot of weight, and we decided we're still going to celebrate their wedding anniversary, even though we were not allowed to go into the building. And so we took this picture, and which is really interesting is, if you notice in the bottom, there's my siblings and myself, but my dad has some affinity to this shirt because he keeps wearing this shirt in a couple of other pictures over the last couple of years. But in all adversity, there's opportunity, and that's what I'm going to speak to in the next slide. So I started to think, what is resilience? And the American Psychiatric Association defines resilience as a process of adapting well in the face of adversity, trauma, tragedy, threats, and when there's significant sources of stress, such as family and relationship problems, serious health issues, workplace, and even financial stressors. Next slide. And I wanted to say, with resilience, it is a journey. It is something you develop, and it's not a personality trait. Okay, so think about that. And as we all look at how we are different as human beings, a lot of our caregivers, when they for the last 6 months, caregivers that I've spoken to, they have said that they've been able to have an improved, or they've acquired improved awareness, self-awareness, that allows them to recognize how their emotions are affecting the person they care for living with dementia, and now just that awareness that is affecting their own health. So I said, yay, thumbs up, good for you to just start with that awareness. And then I noticed that during the holidays, a lot of the caregivers were able to then give feedback saying, you know what, I realize it's okay. I don't have to drag my mom or dad with dementia to all of these family outings that we have. Like, on Christmas Day, we have all these traditions. And so we go to 2 people's houses, and we usually have all this food. And then after that, we do open gifts. And so it was so nice to hear people were starting to give themselves permission and saying, I'm going to make it so that we're going to have one gathering at lunchtime, and it's going to be where my mom can take a nap because I'm starting to see that she starts to sundown, and that's not a good thing for everybody. So letting that go. And it's okay. People had a hard time. They told me that, Sara, sometimes I think that if I ask for help, it's a sign of weakness or failure. That I made these promises to my mother that I was going to do everything to take care of her, not put her in a home. And I said, yeah, but that's okay. You're doing that. But for you to be able to continue to safely keep her at home and for you to stay healthy, do you think it's going to be okay if you ask your sister to watch her so that you can go take a nap? Or maybe you just want to go and, sleep in late, or I don't know, get your hair done. And so it was funny because when I gave them permission, it seemed like the professional person, and I'm saying this to you all as providers because that's what they need, is they need your permission sometimes. It's harder to ask a family member or friend, but if you, the doctor or nurse, are saying, no, it's good, it's really important for you to take respite, for you to have a break, and it's okay to do that every day. If you need to go and walk for 20 minutes, and leave your mom with whoever you trust to watch it, that's okay. There were a couple of people that started keeping journals because they told me they would like to be able to see a year from now, and now it's about 2 years, where they're at with that experience. And I have one wonderful caregiver who's a musician. So he started back up at his apartment singing, and then he wrote some music, and then it was so beautiful that he has actually been able to sing to his wife through the iPad. And he's come on some occasions to visit with her. But I thought, wow, he's tapping into one of his gifts that he knew his wife really enjoyed, which was music. Again, acknowledge, affirm the caregiver's feelings. They need to also affirm their feelings and to realize that they don't need to depend on the circumstances, but what decisions, and be okay with the decisions they make. Because, part of it's cultural too. I think sometimes we're really worried about what others think about us. I know for me growing up, that's what it was, is if I did something, if I did something wrong, it would get out to my parents or other people in the community, and I would be shaming them, heaven forbid. So we need to be aware of that. And lastly, I think what we're going to look at next is how family caregivers started to look at changing your perspective or viewpoint. And the whole pandemic would be an opportunity for their personal growth and learning. So this next slide, I forgot where I found it. I hope you can see it, but I show it to a lot of family caregivers when I do some education during the pandemic. And I said, okay, I want you to look at the question, who do I want to be during the pandemic? And right after that big dark red circle, we talked a lot about the fear zone. And for them, that was a good opportunity, as people shared in group how there were more fears that they had. But when they looked at the learning zone, this was in December of 2020, they started to realize, like, hey, there is some things I can change about how I respond and not react to what's happening in the community with the COVID. And there were a lot of people. There were a lot of people that were dying. They knew friends, families. But when they started to think outside of the box that, maybe there's other things that I need to learn to do differently. And so now a lot of our caregivers have really moved to the growth zone, that I think of the other ways that I can help other people or other family caregivers. I make my talents available to help those who need them. I live in the present, and that is hard for us. We talk about mindfulness, and I mentioned that later on, but what does it mean to be mindful and present? Because I know that as I'm giving this talk to you, I'm thinking about 2 other things I need to do for discharge planning, but I have to remind myself, this is a time, Sara, to really address a topic that's going to, and to be able to share with one another about how we can help our family caregivers. So look for ways to adapt to new changes. I practice quietude. Woo! Yeah, I'm still got to learn at practicing being patient, quiet. But and creative, but I have developed more of an attitude of gratitude, a blessing every day. I'm grateful from my parents that they're still alive, that, I have a job and that I can try to balance life and work and caregiving. But that's still ongoing. Next slide. So here's some strategies that we could look at for building and maintaining caregiver resilience. And you might have heard of this from other people. I do practice Tai Chi. I actually, so I was trained to teach both standing and seated Tai Chi. And before the pandemic broke, came to fruition. I thought about how could I use seated Tai Chi for people living with dementia? And it is amazing. And I found out as I narrowed it down to a time, I started to realize I could do it during the times that most people sundown, and then also before dinner time. And I got everybody mellowed out, and we had very little we had nobody sundowning. And then I translated that to family caregivers, and people just all started to kind of take that deep, slow breath and let go. And their breathing got slower. They got more relaxed and calm. So this is the other, as we continue to look at other factors for building and maintaining caregiver resilience, you can see, looking at opportunities for self-discovery, mindful meditation. There's a lot of mindful meditation tapes. You can even go on YouTube, and I've done that with family caregivers, and nurture a positive way for themselves and spending time with others who share their views. Be proactive. I talk about taking care of yourself physically, mentally, and spiritually. And oftentimes I know we don't spend enough about talking about spirituality. And so I just, again, want to mention that that's really important to family caregivers. And in the sense that I say it's not talking about religion, it's talking about how, again, you look at the world and how you make sense of what's going on. And to reframe, the reframing of crises as impossible problems, and see that it's just a change and it's part of life. Next slide. And I don't know if anybody has questions. Oh, so I was at Project Donna with these family caregivers, and I wish I'd taken a before and after. This is towards the end of doing Tai Chi. And the feedback I got from the caregivers, we said, wow, Sara, we were, for those 10 or 15 minutes, we didn't even know that's how long a time it was. It seemed like forever, but I said, it was only 15 minutes. And they said, no, we really got caught up and were able to focus on just being still and quiet. Lastly, I wanted to talk about our role to promote caregiver resilience and health. And I'm going to show later on a slide that the VA uses. The Xeric burden scale has got 22 questions. And last month, I was so happy to hear Doctor talk about that. And then he talked about the 12 questions, but I want to show you in a minute, the 5 questions. But it's really good. I think the caregiver stress scale or Xeric burden scale. And I thought, our physicians are really, really busy. But if there was a way that when caregivers come into the waiting room, we could give them, this little 5-question thing on a piece of paper. I mean, you do it when you already assess for depression. So, you'll see how simple the questions are. And then if they do rate a certain number, then you would have like another sheet that would have resources for them to look at. I know that you rule out for your caregivers, rule out the risk for the mental health problems that are listed there. And you provide support through empathic listening. I know what I meant by that. So what I wanted to say is, and it's at the end there, oftentimes, if providers, we just ask the caregiver somewhere in between you seeing the patient, so tell me, how are you doing, Aida? How is things going at home? That 5-10 minutes, I guarantee you, just taking the time to listen to them will save you time in the end, because then you can really get to the heart of why the client is there or the patient there in your office. Because if you don't ask them, they're going to start telling you anyway. But if you can you're just acknowledging that you care about them. And that's all they want to know, is somebody out there cares about what they're feeling and what they're going to. They're not looking for a solution or answer, but they haven't. If they're isolated and they feel alone in this whole experience, they don't have anybody to talk to. They feel so isolated. And of course, many of you are role models already about self-care, eating healthy, and exercising. Next slide. So the next slide should be the Xeric burden scale that the VA uses. They use this actually with the home-based primary care program. I don't know if they use it at the long-term care facility there at the VA, but it's really nice and simple, right? You know, those 5 questions, and it's on a Likert scale, a 0 to 4, and anybody that scores a number of 8 or higher, which reflects caregiver burden, the social worker or nurse can make appropriate referrals. And the referrals included everything from support group to, they have a couple of staff that are trained as what they call REACH interventionists, which stands for Resource Enhancing for All Caregiver Health. And then again, they also have respite services, so they can pay for respite services. But those are the questions. You tally it up. And it would be really cool if people had time somehow to include that, you know, when the caregiver comes to your office with the patient. Next slide. So this was just taken in July. And we had family in the back that were visiting from Chicago. But I call it the first family gathering because we hadn't seen each other all together in person. And keeping with the, well, we were all vaccinated, everybody in the picture, and we limited it to 10 people. The funny thing was, this was taken at my sister's condo. They have like a recreation facility, and we had to sign a paper. She had to sign a paper saying you won't have more than 10 people. And we were even at the point that we would only have the 10 and then switch out, and the next 3 would come in to eat a meal. But it worked out where the other 3 couldn't come anyway. But this is, I think, the end result. My mom's gained a little bit more weight, you know, but she's still got a while to go. Next slide. These are great resources. And, you know, I was talking to, let's see, Halikuiki and Catholic Charities. They do a dementia series together, and I'm sure Aida or other people hopefully on this call will be able to speak to that. But the Halikuiki has actually, along with Catholic Charities, they actually have videotaped, audio videotaped all of the dementia series that was done last year. And I think Aida is one of the presenters along with Dr. Kamal Asaki. So I give it all the time to family members, to colleagues, anybody that wants to learn anything from A to Z, because it includes information about like Dementia 101. They have legal presenters, they had attorneys presenting, they had mediation, a representative from the mediation clinic come, and just really great. Okay, and last slide. Oh, so this is the new Senior Handbook. I'm not sure if you all got a hold of it yet. The other one was the orange one. So I just want to make sure people knew that that's like the resource Bible. And lastly, I think I have the last picture. Yay! So my dad just turned 92. And my sisters and I, we try to take him out to give my mother respite because he keeps asking her the same question at least 8 or 9 times a day. So she chooses to be home, but he said he wanted to go out and have dim sum. Thank you for your time, and I'll entertain any questions and comments.
Thank you so much. So I just wanted to just point out in the chat box, there's a couple of links there. So I found, Sara, I think you got the data right from the Alzheimer's Association, that fact,
there's
book,
also that
fact sheet. And so I posted the link there if people want to take a look. And also we actually have a website for our echoes, and there's a resource tab, and under the resource tab we're going to be putting a whole bunch of resources for caregivers during the holidays. For that, how do you do holidays, Thanksgiving and Christmas? And there's a bunch of ideas, and for family members who haven't seen their loved ones for like a year or 2 years, things have changed, and Dementia may have
Mhm.
progressed significantly since then, for sure.
Mhm.
They're not the same person they knew 2 years ago, for sure. Ideas of what to do, what to say, and things like that. So just take a look at those resources later when you have a chance. All right, we have a lot of people here on the call and a lot of different walks, and I'm sure they see lots of different things. So love to hear. So feel free to
I would
type
like
in
to
the
know,
chat
like
box.
from Dr. Morgan, and others, not to put you on the spot. Did you notice that more people were depressed, and did you or some of the doctors see more people dying? Because I did. I mean, the deaths were happening at home, and it wasn't COVID related.
Definitely a lot more anxiety and depression across the board, and makes sense because of the vast increase in the sense of uncertainty on different levels, both globally, all the way down through like, yeah, do I have to disinfect my newspaper? So, and that can really
Yeah.
just permeate people's every sort of waking and sleeping minute. So, and then of course the isolation was tremendously impacting folks, working with folks in nursing homes and long-term care facilities who, like you said, weeks and weeks in isolation. That's like solitary confinement. We know what that does to people, and it's not good. So huge.
All right. Anybody want to share their experiences? I know some people are doing caregiving at home while they're working and being doctors and all. Uh-oh. Can you chat in the box?
Is
Or
that Noreen?
Hi. I have, my husband is also,
okay.
never mind.
Yes, one of you guys got to turn off.
I really want to give a shout out to the nursing facilities as well. The skilled nursing facilities have done just an incredible job. They've been creative. I think of Arcadia, all of them. Holly and I, they did a great job as far as they looked at drive-throughs, to kind of make sure that at least the families could drive through and wave and throw balloons. They did window from from wherever they are. And just to, I guess, just to see the smiles on the faces of those family members, and for the person living with dementia, it must be so hard. If you think for a minute, they can't. It's so hard for them to express what they're feeling, what they're going through. But to have staff from assisted living, the nursing facilities, even the care homes, they kept everybody safe, including the staff, the patients. They've done an awesome job.
Yeah, I have a comment in my private chat, but somebody works in a nursing home and has seen an increase in residents with depression and expressing thoughts of suicide. And that is definitely for sure what's happening. I've actually done a little research on that and looked at a study. Somebody did the sort of an MDS study, and they looked at kind of before the pandemic and after, and during, after, and definitely the percentages went up. So I think that we were all concentrating on, keeping everybody safe, and we kind of, I think, neglected the other part of their well-being, and we really need to pay attention to that because, suicide does happen in nursing homes too.
Mm-hmm.
I'd like to broaden out a little bit from a personal anecdote. I brought my mama to the island, and she had dementia, and I was primary caretaker. I had no job at that point. I had my mama. That was it. It was incredible how challenging it was. Hugely challenging without having kids or a dog or other relatives or a job or so I think that there's a way that we have kind of numbed to how incredibly difficult what we are giving people no choice other than to do or to feel guilty and shamed and bad. So I just wanted to be clear that it's awful. It's getting awfuler. And it was pretty horrific 4 years ago.
Mhm.
And there's not enough, I think, my sense is that there's not enough information in our cultures, that was with an S, to acknowledge what a tough job it is, how nobody says, oh, in 10 years, I want to take care of my spouse or my parent, or, that we don't grow up looking toward that. And it's gotten harder, and it was already horrific. And I will just say the way I got through it was that I had a friend on the East Coast. We made a commitment. She had 2 teenage girls. And every morning we did an hour each way from 4 a.m. to 6 a.m. because my mama was not going to wake up at 6 a.m. So that I had an hour each day to decant what was challenging, what was good, what was hard, what was hard, what was hard, and especially from things from growing up that were still left over, I had never handled them. And here she is in my home all the time doing the same kind of stuff, only less competently. Okay, so that was what I want to add, and I'll take questions if you.
Thank you for sharing, Dr. Allen. Yeah. It's tough. And there's no end in sight, right? I can't promise my parents anything. I don't know when it's going to get better. I don't know. We used to go traveling, my sister and I know they miss a lot of things. And you're doing the best you can. So thank you, Dr. Allen.
Well, I don't know. I have to say, I got a taste of my own medicine a little bit, right? So this pandemic turns out that I live with my in-laws who are both like 89 and then 90 years old, and they actually took their turn going to the hospital for a variety of different health reasons, leaving the other one with dementia under our home care, trying to work and do telemedicine and teach and see patients on virtual medicine and try to intervene before things got out of hand. So, and you know
have
what?
2 teenagers, right?
Well, they're out of the house because that they've graduated, but I have 2 that are younger than that. So, so they're still home. But then it was, in some sense, I had some tools because I knew, I was able to apply the principles that I knew about managing dementia and the dementia approach and needing to, that's really important. I had these tools, but I still had a hard time. And so I cannot imagine for people without those tools, even harder. And even, and I think especially for physicians and providers, asking for help is, hard.
And that's an interesting point, Dr. Wen, because I know even as a social worker, I'm sure if you talk to my sister who's a nurse, everybody in the family thinks, oh, we got a nurse and we have a social worker. And the assumption is they know what to do. And I said, I have news. This is your mommy and daddy too. They gave birth to you, mommy. So you're going to be a part of this. But the point you make is it's hard because we may have the tools, but it's hard for me to separate that out. Because first, I'm a daughter and I'll always want to be their daughter. So even though I know the things, I know these resources, even, all the doctors here on, we're preaching probably to the choir for a lot of people on the call. But when it's personal, it's really hard for me. I really struggle.
All right. Anybody else want to share their experiences and what helped with their resilience? I love that Xeric 5-item scale. I'm gonna have to borrow that.
I got to Dr. Kenneth Xeric. I don't know if he's still, you could reach out to him because I went to a caregiver support program training when he was there giving the talk. And because my beef with this whole thing was there was not a cultural component And so when you look at all 22 questions, and when you ask certain people, do you ever feel, for example, do you ever feel like when you're around your loved one that you're stressed, and like I offended a caregiver by asking that, and I didn't mean to, but culturally, you know, I never got to ask Dr. Xeric if he gave any thought to us trying to revamp it, and you know, do we have to use all these 22 questions? Can I choose the top 5 that I think that would? So I never had time to reach out to him, but at that time, which is like 10 years ago, he was very approachable. So if anybody wants to email him, Dr. Kenneth Xeric, I think he would respond with comments to your comments or questions.
Just want to add a couple more notes about helping caregivers with resilience, which, you know, Sara definitely highlighted as well. I mean, some of the things that I've seen be the most effective are trying to combat the person's sense of being alone in it, you know, because so many people they feel completely alone. They feel like they're crazy. They feel like they're a failure because they're depressed and they're eating, you know, a whole box of Oreos because that's the only thing they can do to cope in that moment, and they've gained 20 pounds. You know, falling into depression, some studies show a lot higher levels of depression among dementia caregivers. So support groups are super awesome. Many people that have attended those as caregivers have found them super helpful, if for no other reason than feeling like I'm